What blood test biomarkers indicate rheumatoid arthritis? When it comes to diagnosing rheumatoid arthritis, blood tests play a vital role, but no single test can confirm it alone. Instead, doctors look at a combination of markers that signal inflammation and autoimmune activity. One of the main biomarkers is rheumatoid factor, an autoantibody found in about 80% of people with rheumatoid arthritis. Rheumatoid factor is most often measured as IgM, but other types like IgA and IgG can also be tested. While its presence suggests autoimmune activity, it's not exclusive to rheumatoid arthritis because rheumatoid factor can also appear in other conditions like Sjogren's syndrome or even in healthy individuals, especially as they age. Another highly specific marker is anticyclic sucralunatide peptide antibodies, or anti-CCP. This test is very good at confirming rheumatoid arthritis because, if it's positive, there's a 97% chance it's true raw. Anti-CCP antibodies tend to stay positive even when symptoms improve, making them useful for both diagnosis and prognosis. A positive anti-CCP result is also linked to more aggressive disease and joint damage over time. However, about 20% of people with rheumatoid arthritis are seronegative, meaning they test negative for both rheumatoid factor and anti-CCP. So diagnosis in these cases relies more on physical exams, imaging, and clinical history. Emerging biomarkers like anti-mutated sucralunatide vimentin antibodies and n-tucubamulitide protein antibodies are being studied to help identify these seronegative cases more accurately. Inflammation markers are also crucial. The erythrocyte sedimentation rate, or ESR, measures how quickly red blood cells settle in a test tube. If the ESR is high, it indicates systemic inflammation, but it doesn't specify the cause. Similarly, C-reactive protein, or CRP, is produced by the liver in response to inflammation. Elevated CRP levels suggest active disease but are not exclusive to rheumatoid arthritis. Both ESR and CRP are useful for monitoring how active the disease is over time and how well treatments are working. More advanced testing includes the multi-biomarker disease activity test, often called the vector test. It analyzes 12 different proteins in the blood, including CRP, to give a score from 1 to 100. Higher scores indicate more active disease, helping doctors assess the risk of joint damage more precisely than single markers alone. Researchers are also investigating other potential biomarkers like interleukin-6, tumor necrosis factor receptors, and enzymes involved in cartilage breakdown, which might improve diagnosis and management in the future. Blood tests like the complete blood count help identify secondary effects of rheumatoid arthritis, such as anemia, which can develop from chronic inflammation or medication side effects. The complete metabolic panel checks kidney and liver function to ensure that medications are safe for each person. It's important to remember that rheumatoid factor and anti-CCP are not used to monitor disease activity once the diagnosis is made because they tend to stay positive even when symptoms improve. Instead, doctors focus on inflammatory markers like ESR and CRP, along with physical exams and imaging, to guide ongoing treatment. While a positive anti-CCP test strongly suggests rheumatoid arthritis, it's not definitive on its own because other conditions can also cause positive results. Conversely, a negative test does not rule out rheumatoid arthritis, especially in seronegative cases. Blood tests are just one part of the bigger picture, which includes clinical assessment, imaging, and patient history. Always consult healthcare professionals for personalized diagnosis and treatment plans. These tests help tailor therapies, monitor disease progression, and improve quality of life for those living with rheumatoid arthritis.